Imagine waking up in a daze unable to account for several hours or even days amount of your time. Imagine that your family had told you that you acted erratically and even asked to be called by a different name. No matter how much you try, you can't remember anything. It's as if somebody was controlling you. And that's just a little bit. And I mean, you guys can imagine the confusion and fear you'd feel. That's just a sample of what people with dissociative identity disorder actually go through. Now, today I will inform you guys a little bit about dissociative identity disorder, which is also called DID. Now, as a psych major now, I find the topic to be extremely fascinating, especially because there's a lot of evidence that they say the disorder doesn't even exist. Now, to help us understand the disorder, I'm going to be talking about exactly what it is, what causes DID, how it's diagnosed, and the several treatments that are available. Now let's start with a little bit of basic overview of dissociative identity disorder. Now, according to the American Psychiatric Association Diagnostic Manual, that's a lot to take in there. It's also called the DSM. It's sort of like the Bible of psychology. All the disorders are in there. The core features of the disorder, there has to be a presence of two or more distinct identities, are also called alters. Now, according to the Cleveland Clinic, each alter has distinct individual traits, meaning basically they act on their own. They have a personal history, and their way of thinking, their own way of thinking, and to notice their surroundings. Also, with the American Association for Marriage and Family Therapy, it says that each personality takes on their own name, temperament, and self-image. Now, it's very rare for any of the people diagnosed with it to have only one alter. There are some rare cases that it's there, and the average number of alters is actually 16. So that's kind of crazy. DID occurs in all races and genders, but it's more prevalent in women. Now, symptoms of the disorder include changes in levels of functioning, depersonalization, which is basically a out-of-body experience. Like you're looking, you know that somebody else, you're watching somebody do it, so, but you can't control it. Derealization, which is all the surroundings around you don't seem real. Something's just a little bit out of whack. They also deal with substance abuse, amnesia, hallucinations, and self-harm. People with DID also have a very, very high rate of, or higher risk of suicide, sorry. According to an article by Scott Lilienfeld, there's doubt about whether somebody can actually harbor more than one personality. This is largely due to individuals with DID usually have a history of substance abuse, post-traumatic stress, and an abusive past, mostly in adolescence. The alters are believed to be a coping mechanism, a way to deal with stress. So now that we have a little bit of a better understanding of DID, we're going to discuss what causes the disorder. Now, the primary cause of dissociative identity disorder is a history and trauma in early development. The type of trauma can actually vary. Any type of physical, emotional, or sexual abuse can trigger DID. According to the Cleveland Clinic, this is true of 90% of DID patients. Other traumatic events can also trigger it. That can include, early loss of a parent, like your father passed away, excuse me, or periods of isolation. Following trauma with DID can appear as a defense mechanism against the physical and emotional pain of a traumatic experience. DID can also be triggered throughout your life by something as simple as a car accident or even rejection of a girl you want to go out with. It can also be triggered in a parent that has DID. If you have a child, once that child reaches that age, it can trigger a lot of the symptoms and the alters. Now that we have talked about the cause of DID, we're going to discuss a little bit about the diagnosis and how it is diagnosed. A diagnosis of DID includes several steps. According to Sumi Slager, a diagnosis of DID requires the presence of at least two personalities that both display control of the individual and the individual's behavior. Now, if symptoms are present, an evaluation is usually done. This evaluation can include tests to rule out physical illness, and a referral to a mental health professional usually is made. According to the Mayo Clinic, medical personnel will rule out the causes of the symptoms. They'll rule out things such as like alcohol and drug abuse in adults, imaginary friends, and children making up different things. Once all those possibilities are gone and they're ruled out, a psychiatrist and a psychologist may use a specialized test such as the dissociative experience scale to make their final diagnosis. And once a person is diagnosed with the DID, there are several courses of treatment to consider. I want to talk about a little bit of those. Treatments include hypnosis and relaxation techniques, medications, and a different variety of therapies. Clinical hypnosis is used to help people explore past memories that they may have hidden from their conscious minds. Meditation and relaxation techniques are used to help a patient become more aware of their internal states and the alters. Together, these treatments seek to help the patient understand their disorder in a way that they can kind of come to terms with it and be peaceful. Medications can also be used. There's no medication actually specific for DID, but they do use different anxiety medications, anti-anxiety medications, and they can benefit from antidepressants, and that may help them cope with it. And there's also several types of therapy to consider for treatment. Psychotherapy, or basically just talk therapy. That's the main course. That's usually what is used to treat it. The goal of talk therapy is to integrate the personalities into one whole. The steps in psychotherapy include uncovering, treating, and consolidation. So, uncovering is basically the process of finding the traumatic memories that happened and mapping them out, or the mapping of all the alters out. And that moves on to the treating stage, which deals with treating the memory and starting to kind of bring them together a little bit. And that leads us to consolidation, which is actually just bringing them all together and making the person one. They also use group therapy, which can be used in addition to the individual therapy. So you already have to be in therapy to be involved in group therapy. And group therapy is also only done with people who have DID. So you can't be just in a group with your mom or your dad or something like that. It has to be with people that have the disorder. So, in summary, dissociative identity disorder occurs following a traumatic event that involves more than one personality, and it's diagnosed through a process of tests and treated with relaxation techniques and therapy. Now, today I've given you guys a little bit more information about dissociative identity disorder. Now, why the medical field debates whether the disorder actually exists. Now, several interesting problems to consider when two separate personalities are in a body. Thank you guys for your time, and have a good evening.